Hello and welcome to the Bubb Report. Last week was yet another deadly week in Grenada as the coronavirus pandemic continues its iron grip on the national population. At the start of the week on September 12th, Grenada recorded its highest daily average of COVID infections, with 158 new infections reported on that day. Last night, 2 further deaths were reported, in addition to the 8 deaths that occurred last week. The data continues to suggest that Grenada is yet to stop or slow the spread. With citizens testing positive every day, the total active COVID case count currently stands at 3,844, with 74 patients currently warded at the General Hospital. Among the COVID dead last week are veteran Grenadian broadcaster Michael Pascal, who spent most of his life in the media fraternity. Also dead last week was Devon Francique, educator and founder of the Las Espacias modeling agency. Francique was also an active member of the Grenada Mass Bands Association, a chaperone for many Grenadian women at local and regional pageants, as well as an adjudicator of many different cultural events.
The other countries put out that girl like if she is in this
universe, yeah.
And we in Grenada is like, oh my God.
You're going to get your stepchild kind of movement.
It's like, what's going on with us?
Yeah.
But mind you, our girls win too. But it's a lot of hard work. Because it's dying. It's becoming extinct. And the storyline behind it, or behind this particular type of mass, stem way back. And just listening to the stories and the stories that the vehicle will bring, you just have to sit there and just imagine what is taking place and so on. And if we give our youth that sort of exposure now, I believe Carnival and this will be so phenomenal.
The list also includes 2 law enforcement officers, ASP Byron Klein and Corporal Anderson Greenwich. A long-standing employee of the Homemade Bakery in Tantine and resident of St. Jules Street in the town of St. George, Veronica Richardson, also succumbed to the virus. Vero was a good neighbor, a mother, grandmother, and dedicated worker. May they rest in peace, and may their memories be a blessing. This week on the report, the Grenadian expat community responds to the current crisis on the island. We speak with a member of the community who is part of an army of Grenadian nationals in North America and Europe, raising funds to support the strained healthcare infrastructure on the island. These fundraising and capacity building efforts have picked up steam last week. We also discuss ways in which the faith-based religious community in Grenada is responding to this crisis, their position on vaccinations, and issues around mixed messaging from various churches with respect to the nature of the pandemic.
This vaccine has not been checked out. What they did is that they looked at symptoms and they tell you, oh, it's like SARS-CoV-1. Same symptoms like SARS-CoV-1. 80% of SARS-CoV-1. But do you know that chimpanzees are 96% human beings, genetic structure, genetic makeup? They are 96%. Have you ever seen a chimpanzee being a human being?
We welcome our guests, Reverend Joachim Philip of the Pentecostal Assemblies of the West Indies, aerospace engineer and member of the Grenadian expat community, Dr. Lucelle Joseph, Salim Rahman of the Islamic Foundation of Grenada, Reverend Silbert Prescott of the Conference of Churches in Grenada, and Reverend Preston Andrews of the Spiritual Baptist Faith Interim Committee. It's the week of September 19th, 2021. We thank you for joining us. A pleasant good morning to our viewers and listeners, and let me apologize for the late start. We were having some technical issues, but we certainly happy that you're here with us for another installment of the Bubb Report. As we start this week's program, we of course wish to extend our deepest condolences to the Grenadian families who lost loved ones last week. We want to salute our healthcare workers and frontline workers who continue to care for the national community with very limited resources and strained manpower capacity at this time. This is indeed one of Grenada's most difficult moments, and those who can help are helping in whatever way that they can. In that regard, a group of Grenadian physicians and an epidemiologist, based in North America and Europe, will be hosting a virtual COVID-19 vaccination awareness event uh, and vaccination awareness event this evening at 5 p.m. to be streamed on GBN television as well as on their Facebook page, with additional streaming on the Facebook page of the Office of Diaspora Affairs. Additionally, the public health caravans are continuing their weekend work across the island in an attempt to encourage vaccinations and to rack up testing and surveillance to get a truer picture of the extent of the infections in the country. Also, the nursing homes last week have been hit extremely hard, prompting some of the administrators at these homes to rethink their protocols. We also learned before coming on stream that for the first time, the sister island of Carriacou recorded its first COVID death overnight. And at this time, I wish to welcome my first guest, Lisselle Joseph. Thank you for joining us here on the Bubb Report. And of course, what we want to do, I know that you are part of a group of diaspora expat citizens, expat Grenadian nationals who are working towards supporting Grenada's healthcare infrastructure at this time. So, could you tell us about, first of all, the genesis of this fundraising event and where you are at this moment?
Hi, good morning. Thank you for having me. So I guess I could talk a little bit about who we are. And what we are really is a coalition of organizations, teams, and individuals throughout the diaspora and also at home. So you spoke a little bit in your intro about, the collection of doctors. We're working with them. So the way that this is made up is that we have a number of organizations abroad, like the Grenada Disaster Preparedness in Toronto, Grenada Carriacou Petit Martinique Nurses Association in New York, the Miami Consulate, the Grenadian Embassy in DC, the UK High Commission, many community groups in highly populated areas like Brooklyn, Queens, Montreal, Toronto, England, as well as people like me who are just individuals living outside the Grenada. So what we are is a coalition of these types of groups, teams, and individuals, and it's spearheaded by the Office of Diaspora Affairs, which is part of the Ministry of Foreign Affairs in Grenada. And really, it's Ambassador Derek James who's leading this and coordinating with all these organizations throughout the diaspora, many individuals and teams, putting us in touch with the people on the ground at home to understand what is needed and try to get an infrastructure in place so that donations and volunteers from outside can be funneled efficiently and effectively to the people on the ground. So like the Ministry of Health, the medical team, like the senior medical officer in Grenada, the Hotel and Tourism Association in Grenada, St. George's University, and many other local organizations and churches. So we're in touch with them, and kind of the connection between the diaspora and these local organizations is the Office of Diaspora Affairs. So that's kind of what we are. It's more of a coalition of organizations.
It's sort of a coalition of different organizations. So
Yes.
now let us talk about just what the nature of the fundraising, the nature of the coalition. What exactly are you mobilizing? What kinds of support are you mobilizing for Grenada?
So after speaking with the people on the ground, and we check with them daily to understand what the needs are. We kind of narrowed it down to 5 main kind of headings. The first thing, the highest priority really, is getting human resources down there. So we're trying to mobilize nurses, doctors, mental health professionals in the diaspora all across the world to actually go down to Grenada and volunteer. We also are mobilizing people in the diaspora to work the COVID hotline in Grenada, because we can do that from wherever we are. So that's the number one priority, getting people to actually help out. Number 2 is obviously PPE and getting large medical devices to strengthen the healthcare system in Grenada. So we've already gotten large donations from different individuals and teams. And so our role and the Office of Diaspora Affairs is to figure out the infrastructure to send this down, get it to the right place, to the right people, in the hands of the people who need it, but also to communicate effectively to the people in the diaspora so they know what's needed and where to send it. So we're kind of that middleman of just informing the diaspora of what's needed on the ground and setting up the infrastructure to send that. And at the end, I'll tell you, how exactly to do that if you want to, join the fight against that. Another big thing that we're working on is home care kits. And the thinking behind that is, since a lot of the spread in Grenada right now is within the community and the home, we want to have people have these home care kits with thermometers and oxygen pulse checkers and at home, so they can check themselves before going out into the community. So we actually are partnering with different medical supply companies in the US and in Canada to pre-make these kits that we will then send down. We're trying to send out 1,000 within the next couple weeks so that we could just hand this out to people so they can stay at home, but also monitor themselves before going out. And I guess the last 2 things is a food drive, and the plan of attack for that is to, yes, we can send food supplies, but we're trying to limit that. What we're trying to do is gather donations and funnel that money into the Grenadian economy and have any foods supplies bought in Grenada from the local businesses and the farmers there. So that way we're feeding people, but we're also strengthening the economy down there. So we have people on the ground working on that, and we're raising funds towards that. And the last thing is we're trying to get more of our people in the diaspora who Grenadians know and trust. And we understand our culture back home, why people might be nervous. People have superstitions, people have religious beliefs, people get wrong information. And we understand that as Grenadians in the diaspora. So we're trying to get these people who understand Grenadians to come and speak to them and answer their questions, so that we don't just have to rely on, global media per se. And these people have been working on the front lines. They have frontline experience. They've seen what COVID can do and what it has done. And so they can really answer your question. So these are kind of the 5 things we've been working on and strategizing as how to best go about getting volunteers for that and getting these things to the right places in Grenada.
What has the progress been like with respect to, you mentioned volunteers. Do we have any numbers as to persons who have given a firm commitment? You're talking about, for example, home kits. Now, what about personal protective equipment? We're talking things like masks and other PPE supplies for the healthcare infrastructure, which, as you know, at this moment is extremely stressed.
So we have a lot of masks being sent down. We're talking thousands. We have a couple of donations in the thousands are on the way and have arrived already, as well as hand sanitizers. Those are the big things that people just know that they need, so they've been sending that out. I don't have the exact numbers as of today. I actually did it this morning, but I don't remember. But it is in the thousands, the tens of thousands at this point. And they're all going through the Office of Diaspora Affairs. In terms of face shields and gloves and the actual N95 masks and so on, we're working on that. And the way we're approaching that is actually partner with medical supply companies to get the lowest price and a shipping in place, and then have people who want to donate go there. So then the infrastructure is already in place to get the best price, the fastest shipping, and get it to the right place in Grenada. In terms of hand sanitizers, we are encouraging people to, again, buy locally from the local companies down there, like Clarkscoat, because again, that's doubly putting money into the economy, but also getting the things we need. So that's where we are on PPE. I think by far that is the largest donations, because people just started donating that from the get-go. The home care kits, we need at least 5,000, and we are ready to start sending those, and we have the website in place. It will be in place by the end of today, so people can start ordering it tomorrow. So hopefully by the end of the week, we should have a good number being sent down to Grenada. Because before we started buying and sending, we had to actually get the companies to pre-make the kits with all the things in it for a 2-week supply for every person.
And you know, Grenada needs all the help it can get now. But in terms of just how are you doing, and how have folks been working together on the committee? Has it been smooth sailing? I mean, you know, have you experienced any kinks? Because you know, with these, especially with such a broad-based type of effort, that is a heavy logistical lift. So,
I'm
how's
really
that?
glad you brought that up, and I'm sure
Yeah.
from the list that I made at the beginning, which is not at all comprehensive. There's a lot of people working on this. You can imagine it is a bit of a logistic maze. So thanks to Ambassador Derek James, he is kind of spearheading everything. He is the go-between between the diaspora folks and the people at home, and that's a real help. We're trying to funnel everything through that office, and that has really simplified things. We're also trying to set up the website where everyone in the diaspora can go and find information about Canada. If you're in Canada, you can find information about that, or the US or the UK or whatever, and also the best things to buy and where to ship it. So to answer your question, I think what we did, and as you said in the intro, this really picked up within the last couple weeks. I think what we did is many of us had the foresight to say, okay, we can't just have everyone who wants to send, which is everybody, just send things. We need to count. We need to tell them what's needed, how much we have, how much we need. And so that kind of foresight has let us put in the infrastructure first, and we're only just starting to really ask for donations and money and receive it now that we have the pipeline in place. Because as you said, had we not done that, individuals would have just been sending bulk items to wherever they think it should go, and maybe everybody would send masks, but we also need, gloves and face shields. So in this way, having the Office of Diaspora Affairs kind of spearhead everything and be the bottleneck between the people on the ground and us out in the diaspora has really helped, and I think curtailed that logistical nightmare that might have happened. Not to say that we're not, we don't have our time zone issues, reaching people. We have jobs, we have families to take care of. So there are things like that that might cause a couple hour delays. But other than that, I think we have a good infrastructure in place thanks to that foresight of the team.
And of course, given that this is a pandemic period, this is really Grenada's first wave. We're talking about runaway infections. We're talking about runaway death, and if we look at the deaths per capita, it's extremely high as a percentage of the Grenadian population. Finally, before we go to the next segment, what message do you have to the Grenadian people at this time? This is a very dark period in Grenadian history.
Yeah, it breaks our hearts, to be up here and not be able to be there with our people, because there are not that many Grenadians in the world, a little over 100,000. We can't lose that many people. So I just want to encourage all the Grenadians to really take this seriously. I know there's a lot of different thinking based on our culture and our beliefs, but I encourage everyone to really listen to credible sources. And if you're hearing something that starts with "they say," maybe check where that's coming from and who the "they" is, and really listen to the doctors, because we can't afford to lose even 10% or 1% of our population. Because when you think about it, Grenada, that will really hurt not just our people and our morale, but our infrastructure and our economy. So I just want to encourage everyone, if you're healthy and you can help on the ground, please volunteer. I'm sure the website will be shared with you guys where you can go ahead and volunteer or donate. The thing that we're stressing here is full transparency. We will report all the donations, who donated what. We report weekly. But I just want to encourage everyone who can volunteer in the diaspora and at home on the ground, please do so. And those of you who are not taking this seriously, this is a crisis. And please start listening to the experts and taking this seriously. We can't afford to lose any more people.
Yeah. To me, one death is too many. Yes, but we have Unison Joseph is asking, can you give information on the groups in our region? I suspect he's referencing the near region to Grenada, the Eastern Caribbean and the Caribbean. Do you have any information on that?
The groups that I listed at the beginning, again, there are groups in Toronto, like the Grenada Disaster Preparedness in Toronto. There's in New York as well as in the UK. And if you guys go to the website, we have a full listing of all those organizations in the diaspora. And we're all working together on this. In terms of the local groups, again, it's really, if anyone wants to contact them, I would suggest you go to the contact Ambassador Derek James first in the Office of the Diaspora Affairs, because he handles everything. But we're talking about SGU, the Hotel and Tourism Association, the Ministry of Health, all these different organizations and teams are working together on the ground as well.
Okay, let's see. We have Karen Park saying, I believe some of the concerns is ensuring that the right people or ideas most in need receive these supplies. Therefore, there is great need for effective and efficient distribution on the ground. Obviously, that would be a decision for the folks in Grenada to make once they receive those supplies. But I think normally that tends to be a concern when people in the expat community donate to Grenada. When it gets there, it's a whole nother story.
Absolutely.
Go ahead.
Again, that's why we tried to set up the infrastructure early, or not early, but before actually starting to ask for donations in bulk, because we want to make sure that everything is funneled through the same system and it gets to the healthcare professionals, the team in Grenada and the Ministry of Health, but also the local organizations, which I'm sure some people trust maybe more than the Ministry of Health or whatever, but we're making sure it gets to different organizations down there that we're partnering with and that we trust. Rather than having individuals send things to just St. Andrews or St. Patrick's or a church down there, we're trying to funnel everything through this coalition of organizations so that it's spread out widely. At the same time, on our website, I don't remember the name of the person who asked the question, but please go to our website. There is a page on there that you can fill out if you are in Grenada and you are in need of help. So you put your name down, your contact information, and you tell us what you need. So then we will flag that and have our team on the ground know, hey, there's these people in this area and they don't have food. And we will make sure someone reaches out to you. So please check the website. There's things on there for the volunteers, the donators, to donate money, items, but also for people who actually need help.
Now, what is the name of the website?
So the website I think people have to remember is the Office of Grenada Diaspora. So if you Google that, you'll find it. And that is linked to the actual website where we're actually taking the donations and stuff. And that is grenadaresponse.org.
Grenadaresponse.org.
.org. That's where you can actually fill out those forms if you want to donate, if you want to volunteer, or if you need help. But if you just Google or Facebook, Office of Grenada Diaspora Affairs, it is everywhere, and we are posting things in multiple places so people can find it. And if you really can't find it, call Ambassador Derek James in Grenada. He is ready and willing whenever to answer your questions and help you get whatever you need.
Okay, and I believe Unison Joseph actually posted that site.
Yes, and he's actually one of the leaders in our coalition. He heads the Grenada Disaster Preparedness in Toronto. A great asset. Yes.
Okay. Wonderful. Is there anything else you wish to add before we get to the next segment?
I do want to just emphasize that when you come to volunteer and donate, there is full transparency. We will report to everyone on both sides what monies we received, what items we received, who sent it, and where it went. So we're trying to build some trust to address the issue that you mentioned, and the question was about. We're trying to build some trust and have a good infrastructure in place. But also, we just want to thank everyone who's already donated. Even before we had this, people were sending things. So thank you so much. And please go to the website. And the last thing I want to say is that, like you said, tonight we're having this great live stream. It's going to be live streamed on GBN as well as the Office of Diaspora Affairs Facebook page, where we're going to have Grenadian doctors on the front line who you can trust answering your questions. So please go ahead, ask your questions there, and hear from Grenadians what it's really like on the COVID front lines, and have your questions answered.
Wonderful. Thank you so much. Thank you so much,
Of course. Thank you
Lisselle,
for having us.
and for responding on such short notice. Of course, this is a fluid situation, so we do understand that folks are busy, and this has been a very, very challenging period for all. Yes, and so
Yes.
we want to thank you again. I hope that your family and everyone is safe.
Thank you. Thank you.
Yes, absolutely. That was Lisselle Joseph, one of the people responsible for the Grenada diaspora outreach that's coming to the aid and support of the Grenadian community at this time. Let us take a quick break. We'll be right back with today's panel. And welcome back, folks. At this time, I wish to welcome our expert panel for the week, joined by Reverend Commander Preston Andrew of the Spiritual Baptist Interim Committee, Salim Rahman, Brother Salim Rahman of the Islamic Foundation. It's good to see you again, Salim.
Thank you.
Yes, and Reverend Silbert Prescott, who is here representing the Conference of Churches of Grenada. Of course, we do have a representative of the Pentecostal Assemblies of the West Indies. That's Reverend Joachim Phillip. He's currently adjudicating one of his services for the week, and so he's going to be joining us at approximately 12 o'clock, 12:15 thereabouts. Salim, I want to begin with you with respect to the Muslim community, the Islamic community in Grenada. How are you managing during this period? How is your community doing?
Bismillah, in the name of God, most gracious, most merciful. Our community, by God's mercy, is doing fine, is doing well. We have been very, very particular to follow the protocols from day one. We understood quickly the way that the virus was spread. And so we shared as much information with our community members, and not only community members, all Grenadians. We shared as much information we could about protecting yourself. That's the first line of defense, in addition to boosting your immune system and so on, and taking vitamins and so on that is recommended. We shared the information and followed all of the protocols. We did so in the mosques. We did so even before it became compulsory upon us. While it was being discussed, we started to discuss and implement procedures in the mosque. Social distancing in the mosque. You had to bring your own prayer mat. Normally, a mosque is carpeted, so people would come in and pray, and then we normally pray shoulder to shoulder. So we made those changes and marked the areas where somebody would have to stand, where people would have to stand, and only families of the same household would be allowed to stand together. Others would have to be 6 feet apart, and so on. We had sanitizers out at front, and at some points as well, when we were instructed to do so by the government, we were making sure and having register of everybody that came and went. And so we have mandatory, you have to wear your masks and wear them properly. We followed all of the protocols, and to date, thank God, we have not had one person, to my knowledge, in our community that has contracted COVID to date.
And Reverend, yes, please continue, Salim. You wanted to end your trend of thought there.
Yes, and that is in addition to it's a highly debated topic, especially in Grenada, as most of our countrymen and women are unvaccinated. That's the statistic. That's the reality. We have to deal with realities, and there's a lot of doubt and so on about it. But with regard to our statistics in our community, we have, I would say, in excess of 80% of our community members are vaccinated.
And we would get into that vaccination conversation, but I also want to hear from Reverend Preston Andrews. We don't normally hear from the Spiritual Baptist community. And again, let me correct myself. It's Andrew and not Andrews. I do apologize for that. And thank you for correcting me. But we don't normally hear from the Spiritual Baptist community in mainstream media or in Grenadian society in general. So I'm really pleased that you are here representing the faith. But in terms of ways in which you have been managing during this period, what has that been like?
All glory and praise and honor to God Almighty. I want to greet everyone else on the panel and to the listening public. Good morning to you. The Spiritual Baptist community is handling this COVID pandemic just like every other body within Grenada, Carriacou, Martinique, and the world at large. Following all the protocols, of course, the constant washing of hands, the sanitizing, the proper wearing of the mask, the 6 feet distance, the avoiding of going into large crowds, and so forth. And from the beginning of the pandemic, we would have implemented the washing of hands. We would have set up stations at the entrance of our churches. We would have do the contact tracing. Families are allowed to worship together, whereas people coming from different households have to be there 6 feet apart. The Spiritual Baptists, as people will know, are very touchy-feely persons or people. We constantly shake hands, we greet after prayer, we greet on entrance, we greet after readings and so forth. And for that, we would have implemented the bowing aspect instead of the touching of hands and so forth.
And let me bring in Reverend Prescott again to you. First time on the Bubb Report. Welcome. We're hoping to have you back again. But obviously, the Conference of Churches, as well, like Brother Preston said, has been challenged during this period. But also during this period, we've had a significant death that a lot of you would have had to really attend to in terms of last rites and so on. So tell us, Reverend, how is that going?
Thank you, and it is my pleasure to be with you and to share with the listening audience on this program. From the perspective of the Conference of Churches, we are aware of the degree to which the recent spike in deaths and the need to have funerals affect us. There are three issues basically that is involved here. Three issues that are involved here. Firstly, the need to lay the dead to rest in a manner that enable grieving families to find solace and healing, and that is very important. Secondly, to ensure that funerals take place in a timely manner and with the kind of regularity that there is no pileup of bodies in a way that overwhelms the system. And thirdly, the need to make funerals a safe and secure environment, or to enable them to take place in a safe and secure environment for the people, for the individuals that have been participating in them. Indeed, these have been a struggle for us. In fact, we have recently convened a meeting with all of the major stakeholders, including officials from the Ministry of Health, funeral directors, as well as religious organizations in Grenada, in order to kind of chart a way forward as it relates to funeral. However, as important as those things are, we are also concerned with the loss of our elderly members in our society. One of our member churches, for example, manages a number of these geriatric homes in the island, and those homes have been particularly hard hit by a number of deaths. And it is really unfortunate that many of these persons are victims of the actions of others. So we believe that it's important to help others to recognize their responsibility, to help each other to recognize our responsibility about how our actions affect one another, and particularly the vulnerable people in society. So we, yes, recognize the issues surrounding funerals and the challenge that they present at this time, but we also think that there must also be a focus on the most vulnerable people who are or have been affected by the COVID-19 pandemic at this time.
And I just want to press you there about the idea of personal responsibility. Of course, the nursing homes in Carriacou, there is a nursing home in St. Patrick, and other nursing homes across the country are extremely hard hit. They were extremely hard hit by the pandemic. Are you suggesting, therefore, that those of us who are able-bodied, the general community who are able-bodied, are not really giving consideration to how they treat with our senior citizens?
Well, I think the the elderly persons who are residents at these homes don't normally go out. They are located on the location where the home is. So what happens is that the persons who go out and come in and interact with those persons are the persons who have to tailor our behaviors in a way that seeks to protect those persons in society.
But in terms of also when we're talking about responsibility, what responsibility, what protocols did the faith-based management organizations put in place to ensure that these nursing homes were protected? I mean, we got a sense that this was coming. So were the nursing homes closed to the public? What was that like?
Well,
I mean, you may not be able to speak to,
yeah, I
because
may
you're
not be
not,
able to speak to
because
it
a lot of these
directly.
homes are run by the
Right,
Catholic
yes, yes.
Diocese of St. George's in Grenada.
But I do know that they have not been open to visits from the public in a general sense. Most of them.
Have you been seeing a demand for final rites and funerals? What has that been looking like?
At present, as I said before, it is a challenge because of the issues that are involved. One, we have to look at or be mindful of the need for grieving persons, as I said before, because while we want to do funerals or conduct funerals in safe and and expedite them in a manner that will protect the community, I think we still need to be mindful of the persons who are grieving, and I think and try to find ways of dealing with the grief that people experience, because the normal way in which people deal with grief and death and funerals, those have had to be curtailed in the past few weeks or months. And so we still have to seek avenues in which we can still reach out to those persons and really enable them to heal in the way that they need to.
Because, as you know, in Grenadian society, the ritual of funerals is not only a religious ritual, but it's also an act of closure, an act of healing, as you said, right? An act of bringing community together. And I see Reverend Andrew Hare is nodding as well. So, I mean, closure at this time is a very difficult thing, you know. So how do people, and I'll ask Celine the same question, what kind of comfort can you give to people who can't really find closure? You can't, for example, go to the general hospital and be close to your relatives who are transitioning, right? What kind of hope you have to offer to the Grenadian people at this time? Reverend Commander, I would start with you, and then Salim, and I'll go back to Reverend Prescott.
Thank you again, Dr. Bubb. Well, within the Baptist community, up till now, we have not recorded any death within our um, faith. I'm not sure if by now, and I pray God that we do not have any death within our organization. However, we are reaching out. We are reaching out to one another. We are constantly advising our members, hey, call a brother, call a sister, see how they're doing. We had some of our congregants contracted the virus, of course, and we would have reached out to them, make sure that they had what was required, make sure that they were following the protocols, making sure that they stayed indoors, because a lot of people who have contracted the virus are home, they have no one to talk to, so we are providing mental health. So by calling ever so often, reaching out, making sure that they are good. When it comes to death per se, before the pandemic strikes us so hard, we would have had one of our spiritual sisters lost a mother, and the time for the funeral would have fallen into the 20 persons per se, and we had to follow the protocol. We would have reached out to her on many occasions. We would have prayed with her. We would have encouraged her. Hey, remember the good memories that you have whenever you're going into a state of stress or depression. Go for a walk. You can call somebody, reach out to speak with somebody. So we have been providing moral and mental support. But when it comes to funerals per se with the pandemic, I think we're going to handle it the best we can, whereby if they're going to give us the urn with the ash, then we will have to make the best of it.
Salim?
Yes. Good morning once again. The actual support, mental support, that is a part of brotherhood. And that is a part that every believer who has faith in God Almighty should reach out naturally, whether it is a pandemic or not, should reach out to his fellow brother and should have an open communication. In Islam, it teaches us that 3 days should not pass without you knowing the condition of your brother. So we should constantly be in touch. And in this particular case, we should even become closer. And this is not only within, the Muslim community. This is within all of our brothers and sisters in Grenada. Because I have a Muslim and non-Muslim family. And I'm not going to choose between my Muslim and non-Muslim. Half is Muslim and half is not Muslim. I love them all. So the point is that we are in this together. And not only from a spiritual standpoint. If a family has COVID, that family is basically locked off. We have to keep away from prejudice and this sort of negative thinking and divisive thinking. And they will need food. When people are sick, they're not in a mindset to cook. Something as simple as cooking. And you need soup and you need things to fortify your system, your immune system. So you may not have all the vitamins, or maybe you didn't get the zinc in the pharmacy because, in Grenada, everything has run out. We run out of things quickly. So we have a limited supply. So if you have a little extra at home, you go and you drop something at the front door and you bring lunch for them, and you, as a community, you make sure that for a period of time that this family has food. It is actually a sunnah, a following of the Prophet Muhammad, peace be upon him, that when a family has a death in the family, and this is normal, this is always, this is not only with pandemic, with COVID. Once there's a death in the community, for 3 days, it is the sunnah to feed that family. Because when that family is grieving or going through difficulty, they're not thinking about cooking and so on. And instead of people going over and waiting for them to get food or waiting for them to get drinks when they go over, no, you bring food for the family. And so you look after them. And, with regard to the the burial, um, the rites, and I use the word right because it is the final right of the deceased to a proper burial. Now we are not dealing with animals, and even people go through all sorts of things with their animals, that they love their animals. Nothing's wrong with that, but the point is that we, the human life is sacred, and when that life is lost, irrespective of if that person dies from COVID or not, that person needs to be treated with dignity, because we are all brothers and sisters. We all come from Adam and Eve. So that dignity needs to be afforded to everybody, and that and the community needs to be together in helping to do so. So, and I think from a physical standpoint, I know some of our younger members have been volunteering, when the ministry has been sending out, especially in the south of the island, sending out to different places, different villages. They would go with tents and they would, test people and so on. And the data collection, and some of our youngsters have been volunteering there. And we have offered our yard space, in the mosque, that they can come and set up a testing facility there, or if whatever the Ministry of Health needs, which we have to help to stop the spread, and we have to help to look after one another, and not not have scorn or fear at this time. This is not a time for to be divisive, and this is a time for inclusiveness. This is a time to come together, and whether we get COVID or not, we still have to go. So, there are people dying every day, not from COVID, as normal. And so, we have to, it's just a little more than normal now, and we have to be our brother's keeper and really help one another. So
Reverend Prescott?
Thank you, Dr. Bob.
Yes.
As you alluded to before, funerals generally it's more than just a ceremony. It's a cultural thing in most of the Caribbean islands, and the community, having the community there, is a part of the process of healing that people look to. For example, people like to have their third night and their ninth night and so on. And also people love to send their members or put their members to rest with a large gathered community. And I think now we cannot do that now, specifically because of the various protocols that are involved. So I think one of the things that two things. One, we have been learning to use the social media, like where you have funerals and then you open it up in a way that persons can join and make comments and share in giving words of comfort and encouragement to members of family. Also, I think it's important to help persons to be mindful of the fact that healing it's a process. It takes time. And therefore, as religious leaders, as church, we have to find avenues, ways and means of working with people, walking with them through the process from one point to the other. So I think it's important that we do these things.
Now, Reverend Prescott, a lot of the mainstream churches, shall we call them mainstream churches in Grenada, have come in for heavy criticism by some. Obviously, the criticism may or may not be warranted, and that has to do with whether or not you were really enforcing some of the protocols, some of the COVID-19 protocols, especially with respect to social distancing, especially with respect to your numbers. Obviously now, because of what is happening, there are strict limits now, but before this first wave, you have been criticized. So my question is, what does enforcement look like in churches with respect to encouraging people to wear their masks, with respect to encouraging congregants to socially distance?
Okay, right. As far as I'm concerned, I know that most of our members have really stressed the whole issue of wearing masks. I think one of the challenges, particularly with regard to funerals, is that when there is a funeral, you don't know who is going to turn up. And if you don't have some kind of law enforcement to deter persons, to say to persons, okay, you can't come in, sometimes it's difficult. And also, it's difficult when people come to say, okay, we can't accommodate you. And this is where I was saying in the beginning that all those issues have been a struggle, and we are learning as we encounter these issues over time. You remember, these are not issues that we have been used to and have had time to, to reflect on and to find ways of enforcing them. However, we have been doing our best, and sometimes it's very difficult to manage, I think I can say.
You're saying it's very difficult to manage. Preston, I'm gonna have you chime in here as well. Would you say that it's difficult to manage?
On a regular Sunday service, no, it's not. We let them know this is the protocols that you have to follow, that you wear your mask, you wash your hands, you sanitize, you stand 6 feet apart, there is no shaking of hands, etc. And they comply. We also have the virtual service online for those who cannot make it or may have underlying conditions, or those that are really frightened by this virus. They can look at the services online. So no, it's not hard managing because everyone has to be safe for them and their families.
And we're gonna segue here. But before we do that, I want to take a quick break, and we will come back, and I'm going to queue up a clip that I was able to put together, and we're going to get into the conversation around vaccinations and faith, and what do faith principles based on the faith traditions that we have here say about that. That has been a contentious debate in Grenada. I think it has gotten to the point where it's extremely toxic, and it is extremely polarizing, as if it were a political discussion. So we will take a quick break here. And gentlemen, thank you for staying with us, and we'll be right back.
So it's not a legal schooling. I know you're sensitive to people schooling you on the law, but I think I can trump you when it comes to the history of Grenada.
What you're saying is that this resignation was expected? Would it be fair to say that you abdicated your responsibility by not showing up in Parliament on Friday?
We are not aware of the terms of the agreement.
But then how can you say the terms are not favorable? You don't know the terms.
We love old talk, we love gossip, we love brango, we love all them kind of things in the Caribbean.
If I cannot play music, I don't know how I'm going to live.
We are borrowing money to pay debt because of corruption, waste, and mismanagement.
That they have difficulty with your leadership. Why then are you contesting the presidency? All right, welcome back, folks. And of course, we want to get into the conversation. Again, I'm not a theologist. Let me say that. I'm an expert in communication. So obviously, I'm coming in here with some very limited perspective, right? But at this time, I wish to welcome Reverend Joachim Philip of the Pentecostal Assemblies of the West Indies. I hope I get your title correct, sir. And you are here not representing the Alliance for Evangelical Churches.
Right. So I'm not representing the Alliance. Neither the Pentecostal, as I said, I'm representing
you're here
pastors.
The pastors. Okay.
Yeah.
You represent the pastors. Okay. So again, welcome, Mr. Philip, to Reverend Philip to the Bubb Report. And so before we get in, we were about to tee up the discussion on vaccinations, but we really want to get from you a sense of how your various congregations are doing at this time and how you are managing what clearly is a difficult period for the national community.
All right. Pleasant evening, and thanks for the invitation, and it's good to be here. It's a difficult time, challenging time that we are in, and we have lost two of our pastoral membership. We have one, Pastor Larry Maguire, and Sister Belfon. We have lost through to the COVID-19 pandemic. And so we are grieving as a district, and as individual churches, we are going through this difficult and challenging time together. We're trying to keep each other and hold each other hand through the process. And so it's a difficult time for us. It's a difficult time for every church member, and we are having times of prayer, times of fellowship that we want to establish so that we kind of reach out to one another in a tangible and physical way. Even though we are limited by movement, we have the digital platforms. And so it's a difficulty that nobody's really 100% prepared for, but due to the despite the circumstances, we are forging ahead and helping our persons prepare. The other part of the question in relation to the pandemic, we encourage and instruct all of our people to maintain your distance, be an example to the community, maintain your distance, wear your mask, and in the areas where we say clearly that we believe that the four things that goes with COVID is the mask wearing, distancing, sanitizing, and once you're medically fit to take the vaccine, you can. We encourage persons to do so.
Okay, and on that note, you've really prompted the next discussion, and that has to do with the various organizations' positions on vaccinations. And I will start with you, Brother Salim. I know that when I was speaking to you this week on Background, you did say that most of your members are in fact vaccinated. Could you tell us whether that was due to members making those individual decisions? What role did the faith play in helping them to make that decision? And would you say that there is a unified approach in how you are confronting this very contentious subject?
Well, everyone is connected today via social media, as we know, and there are a lot of articles, good information, misinformation out there that get shared, and people forward people forward almost anything on social media. And so it was important for us, we have a few of our membership that are doctors, and so we always consult with them, and we consult with with one another on what do you think about this, what do you think about this vaccine, and we read the reports about efficacy and so on. At the end of the day, we did not in our community instruct as we would do in religious instruction. We did not instruct anybody to get vaccinated. We just shared the relevant information and the relevant articles that were from credible sources, and we allowed people to make decisions. Of course, the more that people communicate and they say, well, you take it yet? And so I say, well, yeah, I take it. And you find out that, okay, well, this person took it, this whole family took it, and nothing happened to them. They're okay. Mm-hmm. Yes, they say internationally it has risks. I'm sure it has risks. I mean, driving in a car, getting in a car has risks, right? Flying on a plane has risks. So it's what level of risks and whether I'm willing to take the risk or not, and whether the benefits outweigh the risk. And so for that, you need education. And then when you see certain members of the community taking it, and some people are always leaders, they will go and they will take it in front. And then you look, a month pass, 2 months pass, and more people take it. Eventually, you see that, okay, maybe I should take it, and you do your own research, and that's how it happened in our community. It happened gradually, but it happened early. The bulk of our members took it within the first few months. Mm-hmm. And for myself personally, I was a little more hesitant because I like to research things properly. I like to make sure that, once I put something in my body, I can't take it out. And I need to make sure that, it is of greater benefit than harm. And for me, once I realized that it was of a greater benefit rather than harm, then, I made my decision. But the fact is that our community, through just that sharing and giving people the independence to make their own decisions, providing the right information, we have had more than 80% of our membership or our community members vaccinated.
What is the composition of your members in terms of population?
In terms of population, maybe about several hundred, maybe about, I would say about 400.
About 400
Yeah.
members
I
of,
mean,
of the Islamic
we have
faith.
Muslims in Petit Martinique, we have Muslims in Carrefour, we have Muslims in Grenville and in Sautez and in Boca and all, it's all over the country.
They're all over the country, and
Yeah.
that's what I wish people would understand, right?
But most of the Muslims are concentrated in the south.
In the south of the
There's a large East Indian community that they would have come maybe over the last 40 years or so. They would have settled in Grenada. So that there's a large Eastern community. There's also a large community in, well, not when I say large, it's we're a minority, right? It's a smaller minority religion in Grenada. So, but there is a community in town as well, So there's a mosque in town. There's a mosque in Frequenty.
And I'm going to bring in the members of the other faith-based traditions here, and I want to tee up a clip here as a lead into my question that I have for you. But I want you to listen to a clip. This is from a Roman Catholic priest and an evangelical pastor, and we will have that discussion after I play this clip.
So the so-called COVID-19 that they're talking about, they have never found it out. But all of they tell you, oh, test, and lockdown, and test. And what the symptoms are? The same. What the symptoms are? Flu-like symptoms. How do you know? And the coronavirus, there are many, many coronavirus. That's not anything new. How do you know that what they're telling you is not just another virus? And some of them don't even have symptoms.
What is going on? The problems that we face, the encounter that we face with this virus, God is still calling upon us to repent. He said, if my people that are called by my name shall humble themselves, pray, seek my face, turn from the wicked ways, that he will hear from heaven, he will forgive our sins, and he will heal our land. Healing of our lands come about through the Lord, not through vaccination.
Okay, now this is the kind of rhetoric that the population hears on a Sunday, not only in churches but through the various social media platforms. The population, people of faith, leaders of the faith community, pastors, reverends, imams, they have significant sway. They have significant influence on the national community. People make decisions after consulting sometimes with their physicians, but they also make spiritual and religious consultations as well. So I want to get, and I'm going to start with you first, Pastor Philip. With respect to the evangelical community in Grenada, is there sort of a unified message that you have as a consortium of pastors, that or is just every man to himself who says whatever they want to say that they want to say? Pastor Philip?
Right. The reality of this is that there isn't a one voice message on vaccination, because vaccination was left to have persons agreeing and persons disagreeing. And so a large percentage of the ministers agreed and a percentage disagreed that the vaccine is what we would need to help at this time. And so the thing is, that is because it's non-mandated, it's individuals making decisions. But I think what we need to be careful about as ministers of the gospel is that we don't step out of our lane and run into somebody else's lane in the field here. I keep saying to my congregation, this is a medical thing, and so you deal with it in a medical with medicine. And so once you're fit to take the vaccine, you can, because it's going to help and give us a fighting chance to work against the virus. So some ministers don't believe that, and that's their position. but there isn't that one saying from the evangelical saying that this is it.
And Reverend Prescott, let's hear from you. What is there a unified message, or again, pastors and priests can just preach according to what? And some might say, again, I'm not a theologian, based on what the Spirit tells them, right? Is that what it is?
As it relates to the Conference of Churches, and I know that we do not have an official position per se in regarding the vaccine. In my perspective, I believe that it must remain a personal choice. However, what we have been doing is trying to encourage people to think beyond themselves and to recognize how, as a part of a larger community, one person's action affect the other. I will go further to say that
I want to press you there. You said the conference does not have an official position. Why is that?
I don't think it's because most of us have not. In fact, most of the Conference of Churches, the heads I can speak about, have taken the vaccine and have been promoting the vaccine as a viable means of controlling the spread of the virus. And we are clear about that. Most of our members, leaders that is, continue to do that, as well as to, we have had a number of our member churches have had webinars and other activities to help to present information, to make information available to persons to make informed choices. So in that regard, I believe that we as a church and many of our member churches have been doing their part in trying to encourage people. But what we have not done is to say, well, okay, this is the official position of because it's a difficult situation when you think about it, because persons are on both sides of the fence and for different reasons has opted to take and not to take the vaccine. But we have been really trying to do our part in terms of encouraging persons.
And Reverend Commander?
Thank you again, Dr. Bubb. Firstly, I would like to say that the spiritual Baptist believes in everything being sanctioned first in the realms of the Spirit. Hence the reason before this pandemic hit, we had several visions and dreams coming that people are going to be isolated and you need to be stocked up on food, etc., etc., etc. So if it is a spiritual decision. The church has been advising people to seek medical advice from their practitioners, their medical practitioners, but then also you have to seek inwardly. You have to understand how God deals with you on a one-on-one basis and ask God personally, should I or should I not? And like everything else, an alternative must be given. So if you get the go-ahead to take the vaccine, that's a plus. If you're asked not to, then some reason of, you must get some additional reasoning, meaning don't take the vaccine, but use this, that, and the other, or don't take the vaccine, but isolate. So the church stands on this is you seek medical advice and or spiritual advice.
And that's what it is. Anyone, Salim, you want to add anything to what you've been hearing here? Because I know that your approach has been mostly information based in terms of encouraging your congregants to do the research and things like that. Please unmute your mic.
Yes, encourage to do the research, but it is important to note that God himself gives us the freedom to reject his very existence. And if you think about that for a moment, the creator of the heavens and the earth gives us the right, who created us and everything around us, the right to reject his very existence. Of course, we believe that there will be a judgment and you will have to answer, and that you're not here just on a whim. But the point is that that freedom of choice is an inalienable right. It's a God-given right. And so that is why we share the importance of sharing relevant information and from credible sources, and try to share that. There are arguments on both sides of the fence. The vaccination is a credible path from what we have seen. I mean, I'm not giving medical advice here because I am not qualified to do so. I must make that clear. But from what we have read and seen, it provides some sort of protection. But we note that even before the vaccine came, there were notable people. For example, President Trump, the Prime Minister Trudeau and his wife, they got COVID, and there was no vaccine at that point. So it means that there are probably other ways that one can deal with it, but the clear way that has been given by most of the doctors is clearly through vaccination. So again, but it is important to stress that the personal choice remain, because whether we like it or not, the reality is that most of our countrymen are not vaccinated, and you will most likely have a lot of people, or you will have a percentage of people at the end of this still unvaccinated or unconvinced that this is the path that they want to choose. And so we have to understand that and come to terms with that.
Yes, and I'm being corrected here, and David Antoine is saying, based on the clip that I played previously with Father Gerald Paul, that this is not the view of the Catholic Church and Bishop in Grenada. That I'm aware. I know that the Bishop of Grenada, Bishop Harvey, did stake out the Church's official position on that, which is a reflection of Pope Francis's position as well. But we will be continuing that conversation. We would love to have Bishop Harvey on the report at some point, but I know that in this period of pandemic, he's very busy with saying mass and things like that. But we are aware of that position, and thank you for that observation. Let us get some other comments here. We have a viewer saying, and I think this is for the churches, that the churches went to pray and fast seeking God's guidance for several days, weeks, or months before members make decisions. Folks, you want to, anyone wants to answer that question?
Can I?
Yes, Reverend, go ahead.
I would want to say, first of all, that prayer is not for the church an option when it's not a crisis kind of response to situations and circumstances that we face. So it is not that when a situation, a crisis comes about, we should run to prayer, and when that crisis abates, that we go back to our own way of living. Mm-hmm. Prayer should be, and have always been for the church, something that we engage in on a regular basis that helps us to discern and to know the will of God, right? So the church has always been in prayer. And so the church always believes that its action and its response to situation is as a response is a response to how God is leading us as a people.
Mm-hmm. Anyone else? I by your silence, I suspect no one really wanted to take this. But we have another question here from a viewer. At least 1 in every 3 people in the country are part of a religious community. The church is then somehow responsible for 1/3 of the population, and should encourage members to research more and consider using the solutions to keep them safe. Your thoughts? I think what the brother is saying here is that perhaps there should be more responsibility on your part to encourage proper behaviors in the population. Your thoughts around this issue? Reverend Pastor Philip?
Yeah, well, as I was saying earlier, it's one of the things that just this morning while sharing, after the service, I was encouraging the brethren as they go to this week that you make sure you do the necessary. You sanitize, you keep your distance. Those of you that have to go to work, and you make sure you wear your mask, because that is the era that we live in, is a period in our history. And the Christian has to be the example. We have to set the example for the rest of the population, so that they would understand that God, in his wisdom, he laid down laws. I always say our whole legal system is found in the first 5 books of the Bible. The whole legal frame of how you handle yourself, how you deal with your neighbor, how you deal with issues, is all there. And so Christians must be law abiding and must be citizens that respect laws once it doesn't contravene or go against God's law. And as it relates to COVID-19, there's nothing that goes against God's law. And so I believe we encourage our membership, yes, do what we need to do in this period. It will not stay for the entire time. This too will pass. We have other plagues that came about. We had the bubonic plague, the black plague. We had them coming through, and they took a time to disappear, but they disappeared. And so we will be believing, I hope, doing what we need to do will cause us to get through this process safely.
Reverend Commander, to Brother Ramirez's question there.
Yes, the church has been and will continue to play its role in this pandemic, especially here in Grenada. There are a lot of members within the community or within the church that has not yet made the decision, and some who would have made the decision already. But it is a personal choice. So with the information received, we have to make sure that the medical practitioner within our churches advise and help those that have not yet made the decision to make a decision that is going to save their lives and their families.
Okay, and I think we have a general question for everyone here, and that has to do with a religious conscientious objection. John Crow Alexander is asking, in Grenada, can members refuse being vaccinated due to religious belief? And I want to hear from all of you. Salim, you want to go first?
Sure.
Yes.
Can a person refuse? Yes. Can a person refuse citing a religious reason for this particular vaccine? From an ingredient standpoint, from what we have learned, the vaccine does not contain any human fetal tissue or matter or pork gelatin or anything that is against what we would consume in Islam. So from an ingredient standpoint, that argument cannot be used that because it has something in it that is I can't put that in the body from an ingredient standpoint. And from a religious standpoint, there is really nothing that can be used to say that from a religious standpoint I reject. From a personal, because it has to go to evidence. You have to look at the evidence. And in Islam we are taught, Prophet Muhammad, peace be upon him, said, tie your camel and trust in God. If you, or let's put it to something that Grenadians can relate to, tie your boat, anchor your boat and trust in God. If you don't anchor your boat and you go to sleep at night and you leave the boat there, you come out, meet it in the morning, mash up on the rocks, what are you going to say? You didn't do what you're supposed to do, you didn't take the precaution. So tie your camel and trust in the Lord, you see? And so to use, not as in Islam, we cannot, I don't think it will be able to be used from a religious standpoint. But from a personal standpoint, sure, you just say, I'm not convinced that it's possible.
Mm-hmm. And let's hear from Pastor Philip.
Yeah, I don't believe that there is the same. I don't believe that there is any legislation that say that a person can religiously say we're not going to accept vaccine. I don't think there is any in the books. I don't know of any. So it will not be something that a case can be put forward. That person will have to base that on their religious background. But as it relates to the full gospel, I don't believe we have that.
Reverend Prescott, and then Reverend Andrews.
Thank you. It's a very difficult question because while in the various religions, and even those that are represented here, there might not be a position as such, as in terms of a religious position against vaccines, we must recognize that there are persons who have those positions and who continue to use those positions as a means of influencing people in regarding whether they would take the vaccine or not. However, as I said earlier, one of the things that I think as a Christian church, I try to do or try to encourage persons to do is to recognize how my actions affect other people. I think Paul talks about if what I do cause my brother to stumble, then I should be mindful of how my own actions. And I think this is how I think this is the perspective with which or in which the issue of vaccine must be looked at. Because sometimes, even while we may have our individual concerns and fears, what is good for what is the best course of action for the community? And I think this is where I am.
And that's a good point, right? What is the best course of action for the community? Reverend Andrew?
Thanks again, Dr. Bubb.
Yes. Mm-hmm.
Religion basically is a group of beliefs or a group of believers that believe in the same thing. So if we are looking outside of Christianity, look at the Rastafarians who do not believe in putting any chemical within their bodies or system. The answer definitely will change when it comes to Christianity. So there are religions that do not believe in chemicals being placed in their bodies, and everything has to be natural and from the grounds. And then there are the other religions within the diaspora that will definitely say no. So the answer is based on what you believe or what is your religious belief. So yes, you can make the decision of vaccination or not because of religion.
Okay, interesting perspective. Bob Marisho is commenting here. I don't think that's a question per se, but he says if one pastor takes the vaccine and advises his congregation not to take it, then most people will have a problem with that. Brian Grimes retorts by saying a religious position may be sold as the pastor or the leader of a church saying, do not ingest the vaccine. As simple as that. Okay, and on that note, gentlemen, I want to give you an opportunity for some closing comments. Again, Pastor Philip, thank you. I know that, well, all of you, I believe, except Celine, who I believe is off island, but the rest of you, I know that you have to attend to your various church services virtually. So I certainly want to thank all of you for taking the time to join us today. But I want to begin with you, Pastor Philip, for some closing comments as we get to the end of the program today.
Thank you again, Dr. Bob. The reality is we're living in different times. And so the things that we expected to do before has changed. Things that were normal are no longer normal to do. And so because of the period that we're living in, some things are going to happen and it's going to be uneasy. People don't like change. We're not accustomed generally with change. And so I think people push back against a lot of things because of change, because it's new and it's different. And going forward, I believe, however, we have to learn to live with COVID. I mean, we're going to be wearing masks a year from now. We're going to be still having to deal with the distancing and the sanitizing a year from now because of the nature of the COVID pandemic. What we need to do now is not push back and complain, but what we need to do is learn to live with the present reality. You see, wisdom says that we look to God, yes, we pray, but wisdom says we take action and do what we have to. And so in the taking of the action, I believe it is time to come off of just wallowing and take action, and let's fight this together. So that is why most times we call on all sectors and all community. COVID came in, met us here, is going to pass and leave us here if we team up, if we work together to eradicate it from the community. And it needs bodies to move around. And if we don't give it, then it can't do what it has to do. And so we will help to fight against it. So I encourage persons to be responsible at this time, but learn to live through this period well.
Reverend Prescott, and then I'll get to Reverend Preston, and then we'll wrap up with Salim.
Thank you, Dr. Bob. Grenada is a very or relatively small island with limited resources. We have seen how larger countries than us with much more resources have struggled to cope with the onslaught of the COVID-19 pandemic. Even in the midst of that, what I would want to do at this time is to encourage our people not to lose hope, but to let us continue to do all that we can to promote responsible actions. Because if we are to turn the corner, or even as we say, flatten the curve as it relates to COVID deaths and infection, if we are to defeat this threat of coronavirus, then it will take a united approach. We have to work together. So I would want to encourage the entire nation to let each man look not to his own interests, but to look to the interests of each other. And let us join hands in hands and work together to see how we can cause a dent in this coronavirus that is affecting us all.
Reverend Prescott, one note, it would be remiss of me, pardon my ignorance, what faith assembly are you affiliated with, your church?
The Methodist Church, sorry.
The Methodist Church, okay, the
Yes.
Methodist Church, okay, because in my research, I really didn't get that clear.
Okay.
So thank you for representing both, of course, your church, but the General Conference of Churches of Grenada. We would want to publicly invite Bishop Clyde Harvey to appear on the report because we know that a lot of the nursing homes in Grenada are under the care of the Roman Catholic Church of the Diocese of St. George's. So we want to get a sense of what's happening there. As a programming note, we're also going to be having someone from the Desk of the Elderly next week to discuss how COVID has been impacting the homes. But Reverend Preston, I will get to you for some closing comments.
Thank you again, Dr. Bob. This COVID-19 or this world pandemic is bigger than me, bigger than you, bigger than the government of Grenada, bigger than the churches. What I want to advise everyone is to follow the protocols that are established by the World Health Organization. Wash your hands, sanitize, keep your social distancing, avoid large gatherings, and all the protocols that are established, that you follow them. I also want to encourage the people that are affected mentally, the people that would have lost their loved ones. I want to sympathize with you. Please accept my sympathy. And as you go through this time, I pray that you will find hope in God. It is a personal decision to love and to follow God's teachings. And so I want to encourage those of you who know Him as your Lord and personal Savior to find comfort in Him, trust the process. If it means that you need to take a short walk ever so often, look at television, reach out to somebody, pray with somebody, worship at home, put on some music and dance, do what is needed for your mental health. I also want to encourage us as a nation to keep praying. Thank you.
All right, that was Reverend Commander Preston Andrew of the Spiritual Baptist Interim Committee of Grenada. And Brother Salim, we will end with you. And of course, before I want to get to one of the viewer comments that said, moral of today's conversation, tie your goat.
Exactly.
And in reference to what you said earlier. So the floor is yours.
Exactly.
Brother Rahman.
The reality is, thank you, Dr. Bob. The reality is that we will all return to our Maker sooner than later. That is the reality. We must follow the protocols so that we can see this current wave behind us, and hopefully by the mercy of God Almighty, we can get this entire pandemic behind us at some point. But we must follow the protocols and lead by example so that the others in the society will follow and therefore as a society we'll be more responsible and safe. At the same time, we must endeavor to be the best human beings that we can be, and not allow because our fear cause us to be divisive and cause us to be separated from one another, meaning that we must be separate, yes, physical distance, but not within our hearts and not within our outreach and not within our efforts. This is a time for caring. This is a time for sharing. This is a time for the humanity, our true human nature to show. And I would like to end with a verse from the Quran where God Almighty says, "Do not think that you will say that you believe and you won't be tested. Even the prophets before and those who were with them used to cry out, 'When will the help of God come?' But verily, the help of God is always near." Thank you.
Brother Salim, again, thank you for bringing the perspective of the Islamic community. And please send my regards to your dad. He's the gentleman that I always consulted with on matters of the private sector during my days of a young reporter in Grenada. And he's someone that I truly admire and respect. So thank you again, Brother Salim. And I will end here for today, but we just want to get some final viewer comments. Leo Edwards saying, "Thanks for the great show. One of the few verses I remember from my Pentecostal days is James chapter 2, verses 15 to 17. If a brother or sister is naked and destitute of daily food, and one of you says to them, 'Depart in peace, be warmed and filled,' but you do not give them the things which are needed for the body, what does it profit? Thus also faith by itself, if it does not have works, is dead." Sage advice from one of the holy books that is used by a lot of the people of faith in Grenada. And on that note, I wish to thank our producers and those who really worked hard in putting this program together. On behalf of myself and on behalf of the entire production team, I want to thank all of you again for joining us for the report. And please, Grenada, stay safe at this time. Be kind, be vigilant, and have a safe and productive week ahead. Bye-bye.